President-elect Donald Trump is rounding out his cabinet with several choices to lead the nation's top health agencies. Trump has tapped environmental lawyer and vaccine critic Robert F. Kennedy Jr. to help reshape U.S. health care as Health and Human Services Secretary. The president-elect has also selected Dr. Mehmet Oz for the Centers for Medicare and Medicaid, Dr. Jeanette Neshawat for Surgeon General, Dr. Dave Weldon for the CDC, and Dr. Marty Makary for the FDA. CBS News has also learned that Jay Bhattacharya is Trump's top choice to lead the National Institutes of Health. Bhattacharya is a Stanford University medical professor and economist. He has supported overhauling the NIH, which oversees biomedical research in the U.S. He's also been critical of former NIH director Dr. Anthony Fauci and argued against lockdowns during the COVID-19 pandemic. Dr. Richard Besser joins me now. He's the president and CEO of the Robert Wood Johnson Foundation, a health-focused nonprofit. He's also former acting director of the Centers for Disease Control and Prevention. Doctor, thank you so much for being here. Out of all the names that I just mentioned, anyone in particular among Trump's health picks that are raising the biggest red flags for you?
Well, Lindsay, I have to say it starts at the top, and that's with Robert F. Kennedy as the Secretary of Health. There are a few people in America who have done more to undermine people's faith in our vaccines than Mr. Kennedy. And so having someone in that role who has a big microphone and a big ability to influence what people think, who does not believe that we have one of the best systems for approving vaccines in the world, that's really concerning to me as a former pediatrician and public health professional. Because 30 years as a pediatrician, there's nothing I did that I know had more proven health benefit for my patients than making sure they were vaccinated fully and on time. And anything that could lead a parent to question whether they were doing the right thing by getting their child vaccinated for school worries me greatly.
Well, all of President-elect's choices have been highly critical of vaccines at some point, including his pick to lead the CDC, Dr. Dave Weldon. What impact could that have on public health?
Well, I have big concerns about Dr. Weldon as well. Part of it has to do with the stance he took around vaccines when he was in Congress. He was a major proponent of a connection between vaccines and autism. When the National Academy of Medicine studied that in detail and found there was absolutely no connection, he didn't buy it. He didn't accept it, and that concerns me because you need the head of the CDC to be someone who really believes in the power of science to answer important questions. I worked at the CDC for 13 years. I've never worked with people who are smarter, more committed to the health of people here and around the world. Dr. Weldon also will be leading an agency that plays a critical role in our nation whenever there's a public health emergency. We don't know what the next emergency will be, but I can guarantee you we will have additional public health emergencies. And in order to restore trust, you want to have someone in that role who has public health experience. And Dr. Weldon is a physician, but he has no experience in public health, and having someone in that role does concern. Without that experience, I find very concerning.
I mean, that said, doctor, there are multiple outbreaks right now that are causing concern for public health officials. Are we prepared? And you said that you worked at the CDC for 13 years with many career professionals. I mean, a lot of his picks signal a shakeup and maybe even a desire to maybe remove some of the institutional employees of those agencies. What are your concerns with that?
Well, if you look across the department in every area, you see incredibly talented people who have committed themselves to government service. I think you can always do better. It's always valuable to come in and say, okay, how do we do this job better? How do we ensure that we are working for the American people as well as we can? I worked at the CDC under Republican and Democratic administrations. And I never had any doubt that the people leading the department believed in the people who worked at the CDC. I have great concerns when people are coming in saying not just that they want to shake things up, but that they feel that the work that the agencies are doing is not good. That wholesale departments have to leave. That's very concerning. And I hope in the confirmation hearings that the senators ask tough questions, and in particular with Mr. Kennedy, ask the question: is this someone who will improve the health of people in my state or not? And if not, the answer is no. You have to go with it and vote your conscience.
Dr. Richard Besser, thank you for your time and for sharing your thoughts with us.
Thanks very much.